Good afternoon, ladies and gentlemen, and welcome to another episode of our Usapang Lang. This time, our topic is quite interesting. No? I'm sure hindi ito madalas na pag-uusapan ng mga natin, no, sa ating pasyente. So that's why we decided, no, to invite a very important person to discuss our topic for today or this afternoon, which is sex in COPD. But before that, okay, before I introduce to you our speaker, of course, we would like to thank our partners. Without them, hindi po matutuloy every Saturday ang ating usapang lang. So we have UAP, Valuing Life, Breathe Freely, and Natra Farm, okay, ang nagmamahal Natra Farm. And of course, AstraZeneca, What Science Can Do. Okay, to start the ball rolling, I'd like to introduce to you our speaker for this afternoon, who will be discussing the topic sex in COPD. He is a past president of the Philippine College of Chest Physicians, and of course, a former chair and member of the PCCP Council on COPD and Pulmonary Rehabilitation. Ladies and gentlemen, I'd like to introduce to you Dr. Tomas Realiza. Dr. Tom, magandang hapon po.
Good afternoon, Jude. Thank you so much
Kaya
for the kind introduction.
marami po nga nag-aabang, no, sa topic natin ngayong hapon, no, kasi gaya ng sabi ko kanina, siguro hindi ito madalas na pag-uusapan, no, ng ating mga pasyente, no. Merong ang tatanong, pero may iba parang tumatahimik lang, no, pag ito yung napag-uusapang topic. So nandito po ngayong hapon si Dr. Tom Realiza, isang expert sa COPD po, sa COPD hindi po sa sex. Okay, sa COPD po. Okay, Dr. Tom, take it away po.
Thank you. I'll just share my screen. Hindi ko pala na-load yung slide.
Dito. Dito.
Wala ba ako?
Yeah. Open yung slides mo.
Ngayon pa lang.
Okay.
Do you see my slides now, Joanne? Jude?
Yes, Doc.
Okay, so thank you once again for that kind introduction. I want to assure you that this topic was given to me by the PCCP Advocacy Council. So I would have wanted a more conservative title, and it would have been the COPD patient and sexual concerns, so that the focus is the patient and not the sex. So some disclosures: I used to be a heavy smoker. Now I am just heavy. And I have COPD. I'm a certified obese pulmonary doctor. And for which reason, it's really quite hard to be a obese pulmonary doctor, because you will have problems with your stethoscope, putting it on a patient's chest who may also have a big tummy. So very important for doctors to be fit. The other thing that I want to put across is I am definitely not a sex guru. My neighbor commented on my morning moans, thinking it was my morning sex routine, when in fact that was just me trying to stand up from my bed. So what are our objectives for this afternoon? We will try to take a look at the sexual concerns of patients with chronic obstructive pulmonary disease. So living with a lung condition that leaves you short of breath can get away of sex and relationships. Sex is important. It's a human need like eating, exercising, and sleeping. So this information aims to make things easier for you and your partner to enjoy your love life. It is an important part of life of many people, and this doesn't have to change because you or your partner has a lung condition. COPD is part of the so-called chronic respiratory diseases that affects the airways and other structures of the lungs. And common in the chronic respiratory diseases would be COPD and asthma. And the culprits are usually tobacco smoke and other risk factors like air pollution, chemicals, dusts, and frequent infections in childhood. Although these diseases are not curable, but when you give medications to these patients, you help dilate major air passages, you improve their shortness of breath, and you can help control the symptoms and increase the quality of life for people with the disease. So the WHO Global Alliance Against CRDs has a vision of a world where all people breathe freely, particularly in the area of our world. So let's just try to take a look first at COPD. So it involves usually the airways, and these are damaged and making it harder for air both to get in and get out. It is called obstructive because it limits the flow of air into and out of your lungs. The other reasons for the obstruction would include more mucus, mas maraming plema, than normal, blocking your airways. Because of the damage, your lungs and airways lose their elasticity, the ability to stretch, to be able to put in air and to put out the air. And the walls of your airways become thickened, inflamed, or namamaga, and your lungs partly are damaged or destroyed over time. Common terms that you probably have heard would be emphysema or emphysema and chronic bronchitis or bronchitis. These are the older names for this condition. For some physicians, when they explain to the patient, they are short of words because there's no local equivalent to COPD. So they will just tell their patients, parang hika. So a good number of the symptoms is mainly the breathlessness, or they feel short of breath. Others would include a cough that lasts a long time, usually more than 3 months, and a cough with mucus during most of the days. There can also be wheezing or the whistling sound when you breathe, and chest tightness. So this is actually the airway of an individual, and you can see that it has an opening inside, and this can be partially occluded by constriction, no? By inflammation, pamamaga, by the presence of mucus. So these ones will make it difficult to breathe in and out. So, well, this is just a cartoon showing that these two ladies are saying they're not actually whistling at us, they're wheezing, referring to two old individuals, because COPD is a disease of the older age group, usually 40 years old and above. So when they are feeling short of breath, they usually have problems even with simple everyday activities, like walking short distances or climbing a few stairs. It can cause a COPD patient to feel short of breath. And once their disease actually gets worse, breathing can become difficult, even at rest. We must always remember that feeling short of breath is not a normal sign of aging. because a good number of us who are more than 60 years old actually do not have breathlessness. But those who have some degree of breathlessness ignore it and they delay diagnosis and treatment of whatever disease it might be. So it's very important to talk to your doctor if you are short of breath when doing simple chores and activities. The other thing about COPD are the so-called exacerbations or flare-ups. It's a common complication, and one can see that the signs and symptoms of an exacerbation are the worsening of many of your usual symptoms of COPD. So if your primary problem is breathlessness, you become more short of breath. If your problem is wheezing, it becomes more severe, and coughing as well, and you may have a lot of mucus. So having a flare-up can actually increase your loss of lung function, as well as increasing the likelihood of having another flare-up in the next few weeks or months. So among the treatments for COPD, quitting smoking is the best thing you can do to feel better. Okay? So if you are already having breathlessness and you are still smoking, quitting smoking is the best thing you can do. The other things available to make you breathe better and improve the quality of your life are medicines and inhalers that help make breathing easier and prevent exacerbations. A good number of the inhalers that you are going to use would be a combination of different drugs that will keep the airways open, and the more open they are, the easier for you to breathe. Among the non-pharmacologic treatment, hindi kailangan ng gamot, are what we call pulmonary rehabilitation. It's a specialized program of exercise and education that will help improve your symptoms and reduce your risk of going to the hospital. Of course, vaccinations will be recommended and oxygen therapy for those with advanced lung disease. So pulmonary rehab is important, an exercise and educational program for people with chronic lung disease such as COPD. And this is one of the key approaches to treatment. It helps reduce shortness of breath, fatigue, improve exercise capacity, and a positive effect on your mood and quality of life. So rehab includes a gradual program of low to moderate intensity exercise to help with lung function and breathing exercises to help strengthen chest muscles. Education on medicines, nutrition, and other aspects of daily living, and help with quitting smoking. So the other aspects would actually include the ability to be intimate and to have sex with your partner. If you look at the global initiative for COPD, including the local guidelines, they would actually recommend, even in all the groups of patients with COPD, physical activity is always recommended. Go on with physical activity. And for those with more severe disease, pulmonary rehab should be there, and all these other measures that we have talked about earlier. So we want to focus again, physical activity and pulmonary rehab being the non-pharmacologic features that you can offer to your patient. So to be able to put yourself into the shoes of somebody with COPD and who may want to raise the issue of intimacy and sex, just take a look at this. Just imagine if I were unable to have an orgasm or an erection, what would I do? If my partner were unable to have an orgasm or an erection, what would I do? If a friend were experiencing a sexual dysfunction, What advice would I give to him or her? All this in the background of a chronic respiratory disease called COPD. Just imagining it, I'm already a little breathless. There are certain myths that we need to put across when one speaks of sexuality and disability. And the largest myth about people with disabilities is that they are less sexual than are persons without disabilities. Another myth is that sex means sexual intercourse. It's not always the case. Talking about sex is not natural, proper, or necessary. So some people avoid talking about it because they think this way. And then, of course, sex is for younger people. So sex does not recognize age. It's for everyone. And the other myth is that men should initiate the sexual activity. So women should always be flirtatious with their husbands or partners. It should. Another myth is that it is spontaneous. Spontaneity may not always be the case. And then, of course, a firm penis is a requirement for satisfying sex. That's another myth. And quality sex ends with an orgasm. Especially if you have COPD and you get breathless, you don't even have to reach orgasm. You may need to rest and you may need to take a pause. And that's why intimacy may be the only thing that can be offered or be enjoyed at that moment. So intimacy isn't just about intercourse. When you're not feeling up to having intercourse, there are other ways of expressing intimacy. And you can become, and this can just become as important, like kissing, cuddling, bathing together, massage, and touch are aspects of intimacy that are just as vital as intercourse. In terms of physical factors in sexual dysfunction, one of the things that actually happens is that sexual dysfunction increases with age. We have mentioned earlier that COPD may be associated with aging, so it can be an issue. Disease, disability, illness, use of prescription and non-prescription drugs can also contribute to sexual dysfunction. So make sure you discuss with your physician what are the effects of your treatment to your sexuality. Interventions that may occur on the function in people with COPD. The problem with sexual function in COPD is that it is thought to be at a greater risk of having problems with sexual function than other people their age. And these problems can include the problem of maintaining an erection for men, reduced sexual desire, difficulty in achieving orgasm, discomfort during sex, anxiety about performance, and then sex is not being pleasurable. So these are some of the things. Okay? When one talks about anxiety about performance, because people think they want to really do their best. And there are those who have the problem of spectatoring. They always think that they want to do it as if somebody was watching. So in terms of erectile dysfunction in COPD patients, okay, it is a comorbidity that is frequently seen. And with decreasing sexual interest, testosterone levels, and sexual function by aging, and the presence of chronic illnesses, erectile dysfunction is one of these comorbid diseases. The problem, though, is that doctors should avoid giving you the drugs for erectile dysfunction because these drugs have been shown to produce more hypoxemia in patients with COPD. Because these drugs are usually given for pulmonary hypertension, but when given to somebody with COPD, it has been shown that it produces hypoxemia in them. So always discuss whether you're going to prescribe erectile dysfunction drugs to these patients. There is actually a nice point on the cat in the hat on aging, where the old cat is saying, I cannot see, I cannot pee, I cannot chew, I cannot screw. Oh my God, what can I do? My memory shrinks, my hearing stinks, no sense of smell. I look like hell. My mood is bad, can you tell? My body is drooping, having trouble pooping. The golden years have come at last. The golden years can kiss my ass. It's a very nice poem about aging. So it also becomes more severe in patients with more severe disease. And the breathlessness affects the sexual activity. And this is not a topic often discussed between patients and doctors. And this is something which needs to be improved. Patients will always not ask their doctor. Sometimes the partner may probably raise it with the doctor, but if they are very conservative, this is also not raised. So the doctor must learn the art of opening the topic about sex and intimacy with the patient. The other problem between issues of sexual function in patients with COPD is that we rely on research involving people without COPD. We rely on expert opinion when making decisions how to best advise people with COPD. So more research is needed to be conducted in this area of clinical practice. So as we move ahead, we need to look at balance of risk versus benefit, of science versus myth. So if you look at the goals in the treatment of patients with stable COPD, you want to reduce symptoms by relieving them, by improving their exercise tolerance, and improving their health status. And you can do this primarily with medications, but at the same time, non-pharmacologic means, which we have alluded to earlier. And of course, you want to reduce the risk. You want to prevent disease progression. You want to prevent the flare-ups that we talked about. And of course, you want to reduce mortality or death. So the concerns, we are now closer to the principal topic that we have, would be what effect will COPD have on sexuality? Will sex be possible? Will it be safe? Will it be satisfying? So we need to take a bird's eye view on three things to be able to do that properly. So in a patient with COPD, with progression of their disease, this may lead to a downward spiral of deconditioning. Because with reduced lung function, they are hard in breathing, they will become inactive. They will reduce their activity. They become deconditioned. They will further reduce their activities, including exercise. And this leads to disability and mortality. And eventually, their quality of life is affected. We can actually treat fatigability. We can treat the bronchospasm or the small airway with bronchodilators. But as far as muscle fatigability is concerned, we need to have an exercise program, pulmonary rehab to abolish the fatigability, to address peripheral muscles, and the rehab program is synergistic with pharmacotherapy. So sexual activity takes energy, Beginning an exercise program will help you build your activity tolerance, which in turn will make sexual activity easier and reduce your shortness of breath, both in and out of the bedroom. So if your pharmacotherapy or your bronchodilators reduces symptoms and improves your endurance capacity, if you do exercises, walking, high intensity exercise like cycling and resistance training, you actually further improve your endurance capacity. So if you feel breathless, reduce your shortness of breath. If you want to avoid activities, you have to stop this vicious cycle right at the start. You need to maintain physical activity. When you want to do less, you should actually be doing more. And when your muscles weaken, you should strengthen them. And when you get more breathless, you should become less breathless by learning the technique, the breathing techniques. And when you feel depressed, you have to improve your self-esteem and your mood. So adherence to your maintenance treatments is crucial to be able to achieve reduction in breathlessness. The challenge is not only to enhance exercise tolerance, but it is actually alteration of behavior. Behavioral intervention may further improve the success to enhance physical activity. Just take a look at the challenge of behavioral change. So this is a fitness center, and you can see that it has stairs and escalators. And those going to the fitness center, instead of taking the stairs, are actually taking the escalator. So what happens to the physical activity behavior? You go up to exercise, but yet you do not use the stairs. So you need to alter behavior to be successful. And you may need to challenge your patients. What fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? So this is what happens in COPD. Tight airway, similar probably to a husband with a very nagging wife who holds his neck so tight. So to intervene, you will need to loosen that tightness and to make them breathe easier and better and becoming more intimate. So we have discussed a few things on pathophysiology, on the effects of exercise and sexual problems in patients with COPD. So we will now address concerns. To be able to address that, I am proposing, and I would like to summarize the research that we have looked into in our readings, into the 10 commandments to redemption in COPD and sexual concerns. So does a diagnosis of COPD mean my sex life is over? No? Is it goodbye to sex and other forms of physical intimacy? So symptoms like coughing, wheezing, and shortness of breath will affect patient and partner and may dramatically affect their sexuality. So when one has COPD and you are looking at your sex life, good sex does not become automatic. It has to be planned. It has to be discussed by partners. So to get things right, it is essential to talk with your partner. If you are single, a prospective partner, and you may need to approach the subject openly and directly. Communication is key with your partner or prospective partner. The most important step, the biggest hump to get over, is actually talking with your partner. You have to explain to any new partners how COPD may affect sex. You need to express your feelings and fears honestly so you can discuss and resolve issues with mutual satisfaction. Inevitable at some stage will be frustration about the breathing problem. It's important to talk about the worries. The partner may react by doing everything for the patient. That is not the best approach. The patient must be made to continue their physical activity. They may need to remain as active as possible. Keeping fit will help achieve this. By joining a pulmonary rehab program, you can keep fit, build exercise tolerance. At the Pulmonary Rehab Center, you can have a safe place to exercise. That exercise is safe. Back to sex and energy requirements, it doesn't actually require lots of energy. It's similar to other things. If you can walk up 2 flights of stairs or walk briskly, you can probably handle sex. It just needs scheduling. As I've said, it may not become spontaneous anymore like when you were young, but you may need scheduling. And you can do this when the COPD patient feels more energetic. You can make scheduling a sex game, no? Not a chore. And you can have a wink or any signal. And it need not be at night because they say that some people actually do it better at daytime. So for many couples, sex and COPD do not go hand in hand because of the fear of shortness of breath. The fear can become so great that people with COPD may avoid intimacy altogether. Moreover, if they do not encounter intimacy, they may not be able to maintain sexual arousal or reach climax. Fear and anxiety, these have to be addressed because this can lead to frustration, loneliness, and isolation for both partners. A patient partner and sound advice regarding COPD and sexuality is needed. They can enjoy sexual intimacy once again and rekindle the flame that once burned so brightly. Pwedeng sindihan uli para magliyab ang kanilang intimacy. So now, to summarize everything, we have the 10 commandments to redemption. First and foremost, talk with your partner. Second, keep the lines of communication open. Express your feelings. Third, use your bronchodilator immediately prior or during sexual relations. If necessary, to avoid bronchospasm during the intercourse, it should always be on hand to be used as needed. So adherence to maintenance therapy is essential. Fourth, avoid sexual activity immediately following a heavy meal because this increases your fatigability. On the other hand, you may need to avoid a heavy meal as this may increase your fatigability. Fifth, if you use supplemental oxygen, plan on using the same or increasing amount during sexual activity. Use extended tubing so that there is enough to allow you to place the oxygen tank away from the bed or completely out of the room. So extended tubing, baka mamaya matumba pa yung tangke, matatamaan pa kayo. 6, get a fan. Make sure the room is at comfortable temperature. A cool breeze on the face can help ease the distressing shortness of breath during intercourse. The flow of air can come from an open window or a fan. A simple electric fan can be helpful to keep buildup of body heat from adding to breathlessness. 7th, avoid alcohol prior to having sex, as it can interfere with sexual abilities. 8th, bronchial secretions need to be cleared prior to engaging in sexual activity. This may lessen the severity of breathlessness during sex. So patients need to be taught clearing the airway, controlled coughing technique may be done. So this is very important. Clear secretions. Hindi pala tamon, phlegma pala. No? So it's very important that that is addressed. Ninth, choose easy sex positions that require the least amount of energy. So laying side to side is much more comfortable and far less energy than top-bottom position that puts pressure on the chest. So there are actually a lot of positions out there, but we cannot put it across here. You can actually write to us and we can send you the link to show you the visuals of this. 10th, plan to have the able-bodied partner assume more of an active role in the process of sex so that the COPD partner will be less fatigued. So hopefully, those 10 easy steps to reach heaven will be able to help you. So additional tips, slower erections and delayed orgasms are normal in middle and later life. So communication is again emphasized, avoiding a heavy meal and drinking alcohol, simply touching, being touched, and being close to someone helps a person feel loved, special, and a true partner in a relationship. Good sex isn't about giving and receiving. To have the most intimate experience that you can manage, simply lying together and cuddling may in fact do the job. Running your hands through your partner's hair can be an intimate act. Pero minsan, yung buhok ang tumatayo, hindi yung kailangan. So, in the end, you need to stretch your arms above your head, reaching for something on a shelf, bending down, going up a step or stair, standing up. This causes breathlessness. But what you need to do is just blow as you go. Blow as you go. So what's our takeaway here? Expression of love, affection, and sexuality is part of being human. These things don't have to change with a COPD diagnosis. Becoming and staying educated about COPD is the first step in remaining sexual. Preparing for intercourse can make the experience feel more natural and relaxed. Listen to your body, communicate with your partner, be open to new sexual experiences. These steps will help you lead a fulfilling sex life while living with COPD. Thank you very much.
Thank you very much, Dr. Tom. So I guess all of our listeners will now remember the 10 commandments of going to heaven. So, ang natandaan namin ni Gigi is clear secretions. Yun ang pinakamadaling tandaan. Okay, before we proceed to the Q&A, I'd like to acknowledge the presence of the Executive Manager of APSR. We have Ms. Suga Kono. So welcome, Ms. Suga, and all the way from Japan.
Okay, thank you so much,
Hello.
Joan. Hi.
So, thank you for
Yes,
joining us.
yeah, thank you so much for inviting me, Joan and Dr. Judy Guang. I'm sorry, my pronunciation is not good.
It's okay, it's okay.
Yes, thank you so much for very informative lectures. APSL unfortunately doesn't have such a webinar for APSL members. So it is a very good opportunity for me to attend it. Thank you so much.
Thank
We
you
hope
very
to
much.
see you.
Yes, we hope to see you every
Yeah.
Saturday.
Every Saturday. Great.
Yes, every Saturday. Okay, so let's proceed to our Q&A. Dr. Tom, we would like to share to you yung kasi every time that we post yung mga ating mga invites, no, we try to check kung how many of our members or the viewing public, they take a look at the yung posters na pinopost natin, no. So this is courtesy of our statistician, Joanne. So we noticed that when we first posted yung poster regarding our topic for today, no, you can see here that although may variety of age, no, women ang mas maraming naka-view compared to men who are interested. And
Yeah,
when we
interesting finding.
when we boosted the invite, still no mga females pa rin ang mas madami. So why do you think, Doctor? I'm sure hindi sila si mga COPD patients, but baka sila yung partner sa mga COPD patients.
Posible.
No? So sila yung gustong matuto, okay, at gustong siguro like yung inyong discuss kanina yung how to communicate with the partners. With regards to communication, Dr. Tom, who would you think would initiate yung discussing sex in a COPD patient? Is it the patient mismo o yung partner nung COPD patient?
Ideally, it should be the patient, no, because they're the ones facing the doctor, and so it's a doctor-patient relationship. But sometimes the carer or the partner is there with the patient, no, as in our culture. Minsan magkahiyaan yan.
Yes.
So I think it becomes now the duty of the doctor when they are assessing the activities of daily living of their patients with COPD, that it should actually be included in the questions that they may need to ask.
Okay. So do you
There
think
is still interest, if that is still happening or not, because I remember earlier at lunch, one pulmonary physician told me that it was actually him who asked, and so the patient was actually surprised. Pwede pa pala, doktor? No? No? So it needs to be addressed. Somebody has to start it. And if the patients are shy, the physician may have to, that's why I said earlier, should have some art in being able to get this
shape?
patient.
Yes, okay. So doctor, so the reason that it remains frequently neglected, okay, or not discussed is because siguro it is a cultural taboo or because as Filipinos being conservative.
Yeah, part of the mga myths yan na may sakit ka, may disability ka, malibog ka pa rin, no? So, those are things that that actually enter the minds of these people.
Yes. There's a question here, Dr. Tom. Before engaging sexual activity, is it a must that patients should enroll in a pulmonary rehab program?
If it's mild disease, pwedeng, as I've said, just one way of gauging if they can climb
Sabihin ko yun.
stairs or can walk briskly. There are some people who are a little bit more on the severe side, and they may be afraid to become breathless, to do some activity. When they are in a rehab program, they will learn that they can actually exercise, that it is safe to exercise, and that it is safe to engage in this thing. So that's where the advantage of pulmonary rehab comes in. So actually, even in milder disease now, it might be good to put them there because they get educated on a lot of things.
Okay. So doctor, they discuss sexual activity also in a pulmonary rehab program.
Yes, that's a part. No, I remember the first time it was introduced in the Philippines. Dr. Percival Punsal, I would consider him the first one to introduce pulmonary rehab to us, and it's part of his topic. And he actually presented different positions that are less energy requiring for a COPD patient.
Okay.
In one of the meetings, though, a president of the Catholic Physicians Guild reacted badly on the showing of those positions. So I avoided it here now for political reasons, but
We will give them a copy pag nag-request sila. Okay,
so
we
it's
have-
part of the training.
Okay, so that's the importance of enrolling.
So I don't know if UST actually omits it, but
It's part also, doctor. It's part.
okay. So even if you're Catholic and pontifical,
Yes, doctor.
yeah, I remember giving this talk in UST.
Yes, doctor. I was that
The
was
title was changed 3 times before it.
Yes, I remember that was held in the BCI coffee shop. Yeah, I remember that. So, Dr. Tom, we have a question here in the chat box from Dr. Melvin Pasay. What if in the middle of the sexual intimacy, patient develops shortness of breath? So what's the best thing to do?
Yeah, that's why we mentioned during our presentation that they may need to take a pause. Mabibitin talaga konti, no? They may need to take a pause and they will need to initiate bronchodilator therapy. And then once they regain their stamina, then they can proceed. So there are times when this really happens and it may not really culminate in an orgasm. That's why they just need to cuddle. They need just to be intimate if that's the only thing that can be achieved at that moment.
Okay. So don't expect
Don't push
para
it.
ganun. Oo.
Because if you push it, it might cause more anxiety to the breathless patient and at the same time to the partner who may feel guilty that they are responsible for the problem.
Yes. Okay. Or guilty that the patient might end up at the ER.
Oh, yeah.
There's a reaction here from one of our regulars, Mr. Jose Rex Navarrosa from Alcobar. Okay, he says it should not be a taboo to discuss sex positions. Okay, and give oxygen therapy break. Okay, thank you, Sir Rex. By the way, I think Sir Rex is a registered registered respiratory therapist working in the.
Yeah, I did not specifically just put the visuals because we are not assured that it's just a mature audience we have for today.
Okay.
And I did not like to besmirch the reputation of my chess society.
Yeah, okay, another question. If we're going to use O2 supplementation, what is the recommended liters per minute? Do we need to increase from the usual? Say,
Yeah, if your patient is not on oxygen therapy, that means that they have been tested either in rehab or by their doctor that they do not have hypoxemia, there may be no need. But if they want to be sure, usually during the rehab programs, when they do some exercises, they have an oximeter. And if it is detected there that when they exercise, there is some desaturation to below 88%, then usually 2 liters per minute is recommended. And this is titrated depending upon the oximeter. Oximeter now, almost everyone has, I think, because of telemedicine.
yes.
So that's something that they can actually invest on.
Okay.
So it's titrated depending upon. So either that's why we told you there that They can either maintain the oxygen that they are using when they are walking or increase when they do sexual activity if there is some saturation below 88%.
So Dr. Tom, follow-up question. So would you recommend that a COPD patient engaging in sex would have a pulse oximeter na nakalagay while engaging in sex?
Medyo hirap na nga sila no sa position because the positions are quite a bit difficult. They will need their hands to support themselves, no? But it's possible. It's possible with the oximeters now that are quite small and less cumbersome. But they do not actually have to. They can probably do it when they become breathless. And the question of Melvin Pasay, that's the point where you can check if there is indeed hypoxemia. Then the pause is more justified.
Saka ano, Dr. Tom, they cannot concentrate kapag tingin sa daliri na mayroong pulse.
Yeah,
Diba?
that's another reason.
Okay. If medications affects my sexual urge, I think this from Sherwin. Hindi sinabi ano apelido eh, no? So, if medication affects my sexual activity, so will there be any alternative medications? Siguro, doctor, yung mga anticholinergic, siguro sinasabi niya, no?
Yeah, those are the most often mentioned drugs that may be problematic, but not everyone anyway experiences that. So probably if the patients are on some drugs, then you need to ask for adverse events point to this. And if present, then if there are alternatives available, then discuss with the attending physician the possibility. But if not, then they can still go on with the activity with a little more effort.
Okay, thank you. Regarding intimacy daw po, Dr. Tom, so is there any type or the best type of intimacy that may substitute sex? Kasi you mentioned kanina yung mga caressing ng hair, cuddling,
Caressing.
So ano daw doon ang
But sometimes if they are short of breath, you need to avoid yung kissing talaga na intense.
Okay, so ayan, process ba na tanong nito? Walang name eh. Okay. So avoid too much intimacy, no? Baka
depende dun sa intimate act that they are doing. Di ba?
Okay.
That's why it's very important they discuss because baka mamaya yung partner nabibwisit doon sa intimacy na yon na, di ba? May mga tao na ayaw ipuin yung kanilang leeg. Matayo yung balahibo, no? Mga ganyan. So, it's best that they talk about it.
Kaya may bumubulong or may ihip-ihip sa tenga. So, Dr. Tom, do you think a couple needs counseling before, this is different from the pulmonary rehab, so they need counseling before engaging in sexual
if it becomes a problem to them. If yung sexual dysfunction or inactivity with regards to sex affects their relationship, they should be counseled or it should be part of the rehab counseling.
Okay. So you mentioned, Dr. Tom, no, that the COPD patients, the partner will be more active, tama? With regards to the
healthy partner.
The healthy partner
becomes the dominant partner.
Okay. And one comment here that couples should experiment daw with regards to different positions.
That's part of the discussion, no? Because they have to avoid the missionary position. because that's the one that has a great effect on the chest. So that's the one that produces breathlessness. So the recommended positions are usually side by side. The terms like scissors position,
No, I remember that.
things that even people without COPD have not done.
Performed.
So I remember one time delivering this talk, and Malen Mateo asked me, no COPD, but I have not done those positions. But she was my training officer.
I remember, Dr. Tom, you mentioned something about the wheelbarrow position during that time.
Yeah, things like that. So yeah, those are important to be addressed.
Okay, so thank you very much, Doctor. What about changing the design of the room? Will it increase the sexual appetite?
Well, it's very important that the room is neat and clean, no dust, because some of these things may provoke bronchospasm. So they can create an intimate setting. They should try to avoid the silk beddings because they may fall off the bed. Long tubings are important. And then the fan helps based on the studies, the breeze to the face of the COPD patient. And
Okay.
one thing that has been mentioned actually was because sitting position may be less of an energy requiring thing for them. So they should have a good chair that they can use for the sitting position.
Okay. So, ayan po ha, yung mga nakikinig po sa atin ngayon. So, marami pong recommendations na position si Dr. Tom. Okay. Para discuss sa pasyente natin. Okay. Para hindi niyo po gawin sa bahay din niyo. Okay. From Albert, no? There was a study in 2001 by Sean Hofer, wherein home ventilator patient, okay, have 13% increase in sex activity. Okay, is it, so yung sinishare niya lang, Doktor, no? Na kahit naka-home ventilator, 13% daw ang improvement, no, sa kanilang sexual activity. Siguro dahil malakas yung binibigay ng machine na oxygen.
Dahil hindi siya nabe-breathless, ko lang alam kung always synchronous sila.
Yes.
Once it becomes more active.
Okay. So laging merong
Or it might be the vibration that is the culprit there.
Yeah, kasi 13% sabi sa study 2001. Okay. A question from Cynthia. Okay, Cynthia. So Dr. Tom, what degree of exercise capacity is required for sexual intercourse?
It's actually, I think, equivalent to 5 METs only.
So yun yung kinakanang sinabi nyo na about yung brisk walking.
2 flights of stairs.
2 flights of stairs. So
brisk walking.
So parang
for some I've read there's a higher need of this thing if you are doing it with another, not your usual partner. Kasi pumasok doon yung spectatoring and the need for you to perform well, performance level requirement.
Okay.
Non-familiar partner.
So Dr. Tom, for those patients who cannot enroll in pulmonary rehab program, so do you think advising them to brisk walk or yung sa flight of stairs is enough?
Yeah,
para
the
to
physical
start
activity,
engage in sexual activity.
The physical activity advice. So their activities of daily living, they should not, so that to avoid that spiral of decline. So they should continue with their usual physical activities, and then at the same time, increase the intensity over time.
Okay. A question from Joanne. Will gadgets help?
That's another thing they need to be discussed with your partner. because some may consider it as abhorring. But if it adds to the intimacy, it can also be tried. But it has to be by mutual consent.
Okay, so you need mutual consent in case that they decide not to use gadgets. Okay, and siguro si Joanne madalas nasa Lazada to sa Shopee, no, Dr. Tom? Okay, from Mr. Navarrosa, nutritional requirement is also important for COPD. What's the recommended diet for COPD?
May mga usual sila, no? I don't know if in the lectures of UAP, di ba? Meron silang part of that is nutrition. They have recommended, because if you are actually seeing your doctor, you go to the hospital and you are the emphysema phenotype, where you may be losing weight, then that has to be addressed by a nutrition counseling. But for somebody who is actually, who has maintained their weight, so the usual diet, in the past, we used to ask them to avoid too much carbohydrates because remember, it's the CO2, but I don't know if that is part of the myth that is actually being talked about now also, but just the right diet. And then I think there are preparations of nutrition that are available in powder, but I'm not too familiar with that now.
Okay. Another question from Jet. Good afternoon po. COPD patients need clearance first from their doctor prior to engaging in sex, even if their COPD is controlled. So CP
I don't think
clearance.
there's a need for assessment. Actually, the attending physician, if you are already there, the pulmonologist, being an internist, and at the same time asking these patients to go on with their activity, you should actually be in a position to, because you probably know their cardiac history, you know these things, so the so-called clearance may not necessarily be required, but the attending physician can make a risk assessment of the patient and the activity that they are going to embark on.
Yes. Unless the patient also had an MI, yun siguro baka
Yung
recent
MI na
no?
myocardial infarction, hindi
Yes.
MI allowed to go out.
Ayun, siguro baka kailangan ng clearance or cardiac rehab muna. Okay. Another question from Erwin. Okay. So, one reason or reasons for sex problems in COPD includes hormonal. No? So, nagdi-decrease daw po yung testosterone levels, Dr. Tom?
Yeah, we alluded it in one of our slides why COPD patients and erectile dysfunction is common. And one thing that was mentioned there is the reduced testosterone levels.
Yes, okay. From Dr. Caroline Bernadette Kinkay Ignacio. Okay, this is a topic we should discuss proactively with our COPD patients during clinic visits. I mean, is this a topic pala we should discuss proactively with our COPD patients during clinic visits? And Dr. Tom, in your experience, how comfortable are patients with this conversation?
If one looks at the checklist for activities of daily living, then it's part of those that really needs to be asked by the doctor. That's why I said you have to learn the art of doing it because yung kultura natin, baka sasabihin, masyado naman yun si doktor, pati yung aking slide tinatanong pa. No? So it's a must, but it has to be addressed properly based on our culture. Then number two, Sometimes it may be initiated in the one-to-one without any other in the room. No? Even the partner first should not be there because they may feel embarrassed in the presence of another one. And then the moment it's asked and the patient discusses that it's something that might improve their quality of life that needs to be addressed, and that's when the partner comes in for you to discuss, for them to be mutually there to decide on how to proceed.
So, Doctor, during the first consult, discuss na natin about sexual activity.
If you feel that this patient is a little too unenergetic, no? Tingnan mo din, no? So kung medyo hindi pa gaano ka-controlled yung kanyang problema, issues on education and asking these things may not be appropriate yet. So control the COPD, and once they are better and you feel they will be able to do more their activities of daily living, then that's when that should be asked.
Okay. So, I think this question has been answered already, no, yung regarding the use of the inhalers. So I think it was already discussed by Dr. Tom that you should take your inhalers, no, before engaging in sexual activity. Okay. Okay. Are there any other strategies? No, a question from Emma. Are there any other strategies for maintaining and improving the sex life in patients with COPD?
Well, the best advice there is for the husband to keep on dating the wife and for the wife to keep on flirting with the husband. They need to have the fire between the two of them always rekindled.
Yes, so that means, as you mentioned kanina, Dr. Tom, no, hindi, not because you have COPD, -1 na yung activity ng couple. No?
Yep.
Okay, so dapat hindi mawawala sa equation. Okay, so dapat
Tama.
laging...
Otherwise, hindi mabalance.
Yes, hindi mabalance. Okay, so I think we have discussed extensively the topic. I think meron pang pahabol na question. Okay, may pahabol pa po. Yung COPD ba, Doc, humihingal ba? Kasi yung asawa ko nagka-pneumonia siya. From Melin Gomera. Siguro baka hindi naman to COPD, na baka yung hingal is because of the pneumonia. Okay, unless the husband is a smoker siguro, but we need to further evaluate, no, once na control na yung pneumonia and your husband has a risk factor like smoker siya, then may mga symptoms, and we need to evaluate the patient before saying na COPD na yung pasyente po natin. Okay, so Dr. Tom, any parting words sa ating mga listeners, ating mga avid listeners? Every Saturday na nandito, nag-aabang ng topic, ng magandang topic, magandang discussion.
Yeah, my parting words is just that life should continue, that even with a diagnosis of COPD, it has to move on, and we need to address all the aspects that characterize good quality of life. And one of them is to be able to address sexuality and intimacy.
Okay, so to add to that, no, so I think regarding the key messages of Dr. Tom is that you talk with your sexual partner about your COPD and about the problems with sexuality, so that together you can overcome the challenges, no, and achieve greater intimacy. Okay, and another takeaway message by Dr. Tom is that exercising can build up your stamina for lovemaking. Tama po ba, Dr. Tom?
Mukhang mas with emphasis yung pagsabi mo.
Okay.
We're
With
more
that,
emphatic than me.
okay, so with that, thank you very much, Dr. Tom, for a wonderful and fruitful discussion this Saturday afternoon on the topic sex and COPD. Actually, the title is suggested by Gigi. Okay. Initially, conservative yung title namin. Sabi ni Gigi, hindi. Dapat medyo nakaka-excite. Kaya ilagay namin sex and COPD. Okay. Anyway, thank you very much again, Dr. Tom. And okay, additional lang po pala, Dr. Tom, no, when we posted yung ating invites, no, you can see here that we have reached up to, aside from Metro Manila, so meron tayong mga nakakita ng poster natin as far as Zamboanga. Okay, I think we have friends here, no, from the sa Mindanao area. Okay, hello sa inyong lahat. Thank you for attending. Okay, so again, Dr. Tom, thank you very much. Wag po kayo magsasawa. Don't worry, next time hindi na po about sex ang pag-uusapan natin. Iba naman.
Thank you for the invitation.
Okay,
My
thank you very much.
pleasure.
Thank you very much, Dr. Tom. So again, I'd like to invite our viewers to our upcoming advocacy events for next week. We have Usapang Lang Gina Sabi, the Bacona Chronicles on June 12 by Dr. Adelito Posas. And on June 26, we have Managing Personal Finances in the New Normal by Mr. Julius Anthony Shoson. Okay. So before we wrap up, again, I'd like to thank our partners. We have UAP, Valuing Life and Breathe Freely. Ang nagmamahal, of course, Natra Farm. And of course, AstraZeneca, what science can do. So thank you very much. Okay. Stay safe. Have a great weekend, everyone.